Welcome to the Let Me Shut My Door podcast. This is our Leadership Spotlight series where we highlight healthcare executives making an impact on the communities that they serve. I'm Eric Falt with Executive Search Associates, and today I'm joined by a leader whose career spans critical access hospital, regional medical centers, and now multi-facility operations. Please welcome Tony Keene. Tony, thanks for being with us.
Eric, thank you. It's great to be with you today.
Well, listen, I wanted to talk about a rather unique background that you had. What I find interesting is that your background, you came into healthcare with a manufacturing and facilities background, something I don't see often in a hospital CEO. How has that shaped the way you lead?
Well, Eric, it's interesting, coming from a manufacturing background, which, like you said, I spent nearly 20 years in manufacturing. And The manufacturing that I was in was very hands-on. It was very detail-oriented. It required a great deal of attention to detail. It required a great amount of presence to be available for the folks who were doing the processes. And it required a good deal of background knowledge in what the manufacturing processes that were being done, how they were being done, what was the different aspects that might affect those processes, and how you could improve those processes and really be part of the entire situation. And so coming from a manufacturing background, it really helped me to think of things not only at a strategic level, but also very detailed and very focused level.
Excellent. Yeah, it sounds like you're a real hands-on leader, Tony. You've led some hospitals through some of the toughest challenges that we see in healthcare. Before we dive into those, can you give us a sense what drew you into hospital leadership in the first place?
Well, hospital leadership actually came about somewhat by happenstance. Like I said, I was in manufacturing. I was very happy in manufacturing. And unfortunately, when the Great Recession took place in 08 and 09, manufacturing took a big hit during that time. And unfortunately, along with thousands of others across the country, I found myself looking for opportunities outside of manufacturing. So for a few years, I bounced around to a couple of different industries, looked at different opportunities. And then through one of the opportunities, I was able actually to meet and get to know an individual who worked in healthcare. She was actually the marketing director for a regional medical center in the town that I happened to be in at that time. And through building that relationship, getting to know her, getting to understand a little bit more about what she was doing in healthcare from a marketing perspective, it really seemed like an interesting opportunity for me. And come to find out, she was getting ready to retire. And so she reached out to me and said, "Hey, I'm getting ready to retire. I know you've got a marketing background. I know that you've got leadership background. Would you be interested in applying for my position?" And I said, "Absolutely." And I eventually became the marketing director for a regional medical center.
Fantastic. Yeah, it's really interesting how we fall into the careers that we're in. Tony, as you know, financial stability is one of the biggest concerns that I hear from hospital boards. If the finances aren't right, it affects everything else. I know you've had some big wins on the financial side. Can you share an example of how you approached a tough financial challenge and what that taught you about why financial discipline is so critical for community hospitals?
Yeah, I guess, unfortunately, I've had several situations in healthcare where I faced financial difficulties in the hospitals that I've been at, even in, the most recent situation that I've been in, looking at the AR aging reports and looking at the amount of money that is out there to be had, but for one reason or another, payers aren't paying, whether that be, commercial, private payers, all of those types of things, whether that be a situation where, the revenue is just not being generated. So I've had to really, again, back to the detail orientation and the attention to detail. You've really got to have a good understanding of the finances in your organization. You've got to develop good relationships with your payers and those who represent your payers. You've got to be able to work with your frontline folks, those patient access folks, who are working with those patients every day, who are doing the billing and the collecting and all of those things, and really set a priority around financial collections. One of the things that we did in a recent organization is we literally just put together an Excel spreadsheet that was basically a checkbook. And we would look at, what's going out, what's coming in every day, so that we knew where we were at from a day's cash on hand perspective. We knew who we needed to call, who we needed to talk to, who we needed to reach out to get that money, those revenue dollars that were properly supposed to come to us. And so, we were able to make a difference of several millions of dollars in a very short period of time, just by committing resources to looking at the aging, looking at where the payers were at, making those phone calls, talking to those individuals, and making sure that we were getting, every dollar that was coming to us, that we were able to do that. Because as you know, the important thing for any healthcare organization is you have to have that revenue coming in to be able to fund the services that you're providing to your community. And so it's very important that, as one of my CFOs was fond of saying, cash is king, and you've got to have that available cash to do the things that you need to do to serve your patients.
Obviously, that banking background really shows that you are in tune with the finances, even at the chief executive level. So I really think that makes you stand out.
I also think that it's very important that a CEO understands an income statement, and understands the balance sheet, and understands the calculation for days on cash on hand, because, a lot of times, I've seen CEOs get surprised, when they think that they've got a good month or a good quarter coming, and all of a sudden the bottom line numbers don't reflect that. And I think it's important that as a CEO that you keep in constant communication with your CFO and your controller and those accountants to really understand what the cash flow situation is at any given time, because the last thing you want to have happen is come to the end of the month or the end of a quarter and be surprised that all of that great volume that you were able to produce didn't make its way to the bottom line.
Absolutely. Well, listen, I want to shift gears just a little bit. You are really a crisis-tested leader. In your career, was you had to step in as incident commander during a catastrophic flood at the hospital where you were the CEO. Can you walk us through how you kept the wheels on the bus during months of closure, and what that you learned about leading in crisis?
Well, one of the things that I learned immediately in terms of leading through crisis is that you've got to keep a calm head. You've got to keep your wits about you. You've got to assess the situation. You've got to gather folks immediately and understand what the magnitude of the event is. And one of the things that we did that evening when the flood occurred is we got department leaders together. We made phone calls. We got people back in the facility, and we did a quick assessment of what the damage was, what we were going to need to do to get back up any type of operation that we could to be able to continue to service our patients. And so it's really important that you have those subject matter experts in department leadership positions, that you rely on their expertise, and that you are open to their suggestions, because, unfortunately, a CEO can't run everything by themselves. And so you've got to have those folks in place that you can trust to give you the information that you need to be able to assess their own department situation in real time, and then make suggestions on what needs to be done. And so that was the thing that we did going forward. Was every day we met at 8:45 in the morning as a leadership group. We got assessments from all of the different departments on what was working, what wasn't working, what do we need to do to stand up various services, how can we meet the expectations, from a quality standpoint, regulatory standpoint, financial standpoint, and working with all of those individuals to make sure that whatever services that we could provide in whatever capacity, that we were able to do that. And so we had to do a lot of outside the box thinking. I mean, we stood up mobile units. We moved services to other parts of the building that were unaffected. We moved physician offices to our outside sites. And so we were able to get up literally as much services that we possibly could to be able to continue services for as long as possible.
That's one of the things I really admire about your background in strong hospital leaders, is that creativity and finding ways to make improvements even when resources are tight. I know you gave us a good example, but are there other examples where you had to be creative, think outside the box, whether it's facilities improvements or space challenges?
Yeah, in one of the critical access hospitals that I was in, it was a situation where it was an aging facility, aging infrastructure, very much tight financial situation. We knew that in order to attract more folks to come to the facility, that we had to do some freshening of the facility. We knew that we weren't going to be able to have the funds available to do a massive improvement. But one of the things that I learned in manufacturing through the lean training that I had was that you can do a lot with a little. And so one of the things we were able to do is myself and the maintenance director, we went into one of the patient rooms because the patient rooms needed some overhaul. I mean, they really needed a fresh coat of paint. They needed, to be cleaned up quite a bit. Once we got that completed, I went down and, got some of the nurses and brought them down to the room. And I said, this is what I want to do ultimately to all of these rooms, is to make them look like this. It had everything that it needed, bedside tables, all of those types of things. And one of the nurses commented, wow, I would definitely donate to something like that. How much does it cost? And I told her, I said, well, we've got this much in materials in this room, which was not that much. And she's like, we should get folks to donate to this. And I was like, that is a great idea. And so I went out into the community and I, showed pictures, and I invited people to come in, and I said, hey, we want to make all of these rooms look like this. Would you be willing to donate if we put a plaque outside of the room saying that it was donated by you? And by the time we got done with everything, we had all of the rooms paid for, and we were able to do all of the work in about 6 months' time. With no outlay by the facility. All of it was paid for through donations.
Oh, that's excellent, Tony. I know that's not easy, doing a renovation project like that, Tony, but getting the people involved, it can be just as tough as the project itself. You had shared that nurse. How else did you get people involved in that renovation project?
Well, one of the things that I have found is, with leadership is you have to lead from the front. And based on the fact that, I was part of that process and, I was involved, I had my jeans and t-shirt and I was in there hands-on doing the work myself, which I enjoy. I mean, I thoroughly enjoy doing that type of work. And for the other staff to see me in there doing that work really motivated them, because as we started moving through the other rooms, a lot of the staff would say, hey, I got a few minutes. Do you need me to help with something? And so they would pitch in and they would help. And so it just became this just kind of wave of helpfulness of people coming in and saying, hey, I want to be a part of this. And that led to
Excellent.
other renovation opportunities for us in the facility. And so it just, through the course of probably about 6 months, we were able to do a significant amount of renovation at very low cost because the people got involved, and they have a lot of skills outside of just their nursing skills or radiology or things like that. And so tapping into that, especially when you're really strapped for finances and you can't go out and hire a contractor, it's really helpful to have those folks to be willing to pitch in and help. And that starts from the top. And that's what I like to do, is I like to lead by example and lead from the front.
I think that's one of the things I really appreciate about you the most. You'll get down in the trenches, you'll do it. So I think that really makes you stand out. Another thing that really strikes me about your career is you just don't keep the wheels on the bus. You really expand the finances of the organization, and in doing that, expanding the service offering. Definitely no small feat in a community hospital. Can you talk to me about when you've introduced new service lines, what impact that had on the finances and the community itself?
Sure. And, kind of the way I think about these things, again, is kind of born from my manufacturing experience, because I was heavily involved in product development. From a manufacturing standpoint, you've got to constantly be evolving your products, introducing new products, finding new customers. And so a lot of that same philosophy comes to bear in healthcare as well. And, one of the things that you find out very quickly in healthcare is that probably 80% plus of your overall revenue comes from outpatient or ancillary services. In today's modern age, very little of your revenue actually comes from inpatient services or from physician clinics. And so it's important that you have a wide breadth of offerings for folks who have particular needs. And one of the things that we've been able to do in some of the hospitals I've been in is introduce, comprehensive wound care, be able to introduce cardiac rehab, be able to look at pain management. A lot of these things, especially in these rural communities where, sometimes you have to travel, 90 miles, 60, 90 miles to find a larger hospital. To be able to have these services in a small rural community is significant. And it's great for the patients to be able to have this type of care done locally, be able to be done by highly qualified and skilled physicians and providers. And it's a way that you can really revitalize your small hospital by being able to offer these services. And it takes a lot of the pressure off of some of the other things that you may be doing by being able to have these services available to be able to then continue to finance a lot of these other things that you need, whether it's infrastructure improvements, whether it is new equipment. You've got to have the revenue to be able to do those things, and being able to offer a variety of services is the way to do that.
Excellent. One thing I hear all the time from hospital leaders is the pressure to do more with less. And I think that's where your creativity and innovation really comes into play. You shared with us about your creativity in renovating those rooms. Was there a time where you used innovation, whether it's technology or process improvement, that really made a difference?
Well, one of the things that has been really important, especially over the last, let's say, 10 years in healthcare, is the fact that, physicians and staff, they've really been tied to their computers a lot. Because of the electronic medical record systems, all of the documentation systems that are necessary to be able to properly document care in healthcare today. And it's really created kind of a chasm between the physician and the patient. And one of the things that we were able to do in one of my locations was to prototype and beta test AI-driven documentation system, basically where the physician is able to have an application on their phone. Obviously, they ask the patient's permission if it's okay for them to utilize this application. They tell them what it's going to do, what it's about. And basically what it does is it records, and I say that in quotation, the conversation between the patient and the physician. And the primary objective of that is to allow the physician more face-to-face time with the patient, so that they're not sitting there typing on a laptop or doing other things. They're actually able to spend more time with the patient, understand the patient's needs, and be able to develop that relationship with the patient, which is so very important for folks in society today with a lot of disconnection that we have. It's important for them to have that relationship with their physician. Absolutely. And what this AI application does is then it goes through and it filters out all of the noise, which is the non-medical parts of any of those conversations, right, and really keys in on, whether it's COPD, diabetes, or other chronic issues, or even acute issues. And it helps to pre-populate the medical record so that all the physician has to do then is just go through and do some quick edits, which has resulted in hours of reclaimed time for their day, which enables them to be more present for their patient, provides greater efficiency in terms of patient flow into the clinics, and provides for better physician work-life harmony. In terms of, they're not there till 6:30, 7 o'clock at night doing their documentation. They're not sitting with a laptop at their kids' little league game trying to get their documentation done.
Exactly.
the other good thing from a hospital standpoint is this AI generation actually takes such good notes that, sometimes in the documentation, if there's, a few hours between time of visit and when the documentation is completed, a physician may miss a particular part of that encounter. Well, the AI application has captured that, and it allows us to charge for what was actually done in the visit so that, it creates a better opportunity for revenue generation as well.
Excellent. Well, I have to tell you, Tony, I really commend you on doing that. I had firsthand experience with that. I just went to my internist and they just implemented it within the last couple months. And he was touting exactly what you did, what you were talking about. So kudos to you for doing it much earlier. But not beyond the financials and the operations and the innovation, you've really placed a strong emphasis on the people and the culture that you foster within your organization. Honestly, I think that's one of the most important things that hospital leaders can focus on because culture really shapes everything. Can you share an example of how you worked with your teams, getting them engaged and aligned, and what you believe makes the biggest difference in building a strong hospital culture?
Yeah, I think the big difference and the thing that healthcare leaders need to do more of is be engaged with your staff, be present. That's one of the things that, all of us strive for is to build relationships with those around us. And, I've always felt, and at least in my career, I've always wanted to, develop a relationship with the leaders in my organization because I felt that it was important, for me to understand who they are, to better understand why they do what they do. And I think the reverse is the same as well. I think it's important for us to understand our staff, build relationships with them, understand who they are as individuals, what drives them as individuals. And I think it's important for them to know that we care. And I think that, one of the things that I've been able to do is engage with my staff. One of my facilities, I implemented what I call Tuesdays with Tony, a little bit of a takeoff with the Tuesdays with Maury. And I would just take a Tuesday morning and I would go to the cafeteria and sit down with a cup of coffee and, whoever came in. And if they had a question, I would answer their question. We sat down and we had great conversations in the cafeteria about things that were going on in different areas, how we can make improvements, and just getting that feedback from the employees is so important. And, one of the things I learned early on in my healthcare leadership career was, I made a rookie mistake. I had a, employee engagement luncheon and, we were out there barbecuing and we were having a great time. I was behind the grill doing all those things. And then for the night shift folks, we ordered pizza and had it brought in. And boy, that did not go over very well. And so I said, well, that's a rookie mistake I'm not going to make again. So the next time we had a luncheon, we came back that evening with the grills, fired them back up, and we had fresh burgers and fresh hot dogs for the night shift. And that was a good lesson for me, to make sure that we treat everybody equally, make sure that, we have the highest level of respect for the work that people do and for the people themselves. And so I think, one of the things that I've done as well is, I have leadership training that I go through with the mid-level folks to help them understand why those things are so important and how they can be involved in that as well.
Tony, I really appreciate that culture that you foster within your facilities. It's really clear to me from your career that you bring more than experience. You bring that resilience, that financial stewardship, innovation, and that team and community first mindset. For hospitals today, navigating our tough challenges, that's the kind of leadership that's invaluable. I really appreciate you sharing your story with us, Tony. So thanks for being here.
Absolutely, Eric. I appreciate the opportunity.
And to our listeners, if you're on a hospital board or in a leadership role and would like to learn more about executives like Tony, who can help lead you through crisis, build those long-term relationships, reach out to me at Executive Search Associates. We'd love to connect. Thanks for joining us for another episode of Let Me Shut My Door podcast and our Leadership Spotlight series. Have a great day.